An intro music fades in and then fades slightly to background hello and welcome. Today, we're diving into a less common but significant eye condition known as spheroidal degeneration. This fascinating and sometimes visually impairing disease affects the cornea, the clear front surface of your eye. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. So, join us as we unravel the complexities of spheroidal degeneration. What exactly causes spheroidal degeneration? Well, the exact etiology is still being investigated, but it is generally considered a degenerative condition. This means it develops over time, often influenced by a combination of factors. Chronic exposure to ultraviolet, UV light, like from the sun, is a major risk factor. Eye injuries, prior corneal surgeries, and dry eye are also thought to play a role. In some cases, there may be a genetic predisposition, suggesting a hereditary component. Essentially, it's usually a combination of environmental factors and, potentially, your genetic makeup that contributes to the development of this condition. Let's talk about the pathophysiology. Spheroidal degeneration involves the abnormal accumulation of protein deposits within the cornea, specifically in the Bowman's layer, the layer just beneath the surface epithelium, and in the stroma, the main structural layer of the cornea. These deposits appear as small spheroidal or globular-shaped opacities. These deposits are thought to be made of degenerated collagen and other proteins. As they accumulate, they disrupt the normal corneal structure and transparency. Over time, this can lead to surface irregularities, thinning of the cornea, and ultimately visual disturbances. Regarding epidemiology, spheroidal degeneration is considered relatively uncommon. It is found worldwide, but prevalence rates vary depending on geographic location and population. It tends to affect older individuals, typically appearing after the age of 50, although it can occasionally occur in younger people. Men are statistically more likely to be affected than women. People who spend a lot of time outdoors are at an increased risk due to increased UV exposure. So, how does spheroidal degeneration manifest itself? Many individuals with early-stage spheroidal degeneration may not experience any noticeable symptoms. However, as the condition progresses, several signs and symptoms can emerge. These include a decreased visual acuity or blurred vision, especially in bright light due to scattering of light by the deposits, a foreign body sensation or gritty feeling in the eye, increased sensitivity to light, known as photophobia. In advanced cases, the surface of the cornea may become irregular, leading to pain and discomfort. Recurrent corneal erosions, where the surface layer of the cornea breaks down, causing sharp pain and watering, are another potential symptom. Diagnosing spheroidal degeneration typically involves a comprehensive eye examination by an ophthalmologist or optometrist. A slit lamp biomicroscopy is crucial. This allows the doctor to view the cornea under high magnification and identify the characteristic spheroidal deposits. Corneal topography, which maps the surface of the cornea, can help to identify irregularities caused by the degeneration. In some cases, corneal confocal microscopy, which provides high-resolution images of the corneal layers, may be used to further assess the extent and depth of the deposits. These diagnostic tools combined allow for a definitive diagnosis and staging of the condition. While there aren't formally rigid classifications, spheroidal degeneration is often described based on its severity or depth within the cornea. Superficial degeneration involves deposits primarily in the Bowman's layer, while deeper degeneration extends into the stroma. Some sources also differentiate between primary and secondary forms. Primary spheroidal degeneration occurs spontaneously, while secondary spheroidal degeneration is associated with other conditions such as trauma, surgery, or other eye diseases. Describing by severity can be graded by the amount of cornea involved and symptoms level. The treatment and management of spheroidal degeneration depend on the severity of the symptoms and the extent of corneal involvement. In mild cases, where symptoms are minimal, artificial tears and lubricating ointments may be sufficient to alleviate dryness and discomfort. When vision is significantly impaired, several treatment options may be considered. Superficial keratectomy, a procedure to remove the outermost layer of the cornea containing the deposits, may be performed. Phototherapeutic keratectomy, or PTK, using an excimer laser can be used to ablate the superficial deposits and smooth the corneal surface. In severe cases, when the cornea is significantly damaged, a corneal transplant, or keratoplasty, may be necessary to restore vision. It is also important to manage other conditions, such as dry eye, which can exacerbate the symptoms. While there is no guaranteed way to completely prevent spheroidal degeneration, there are steps you can take to reduce your risk. Protecting your eyes from excessive UV light exposure is paramount. Wear sunglasses that block 100% of UVA and UVB rays when outdoors, especially during peak sunlight hours. If you work outdoors or engage in activities that expose your eyes to the sun, consider wearing a wide-brimmed hat. Managing dry eye with artificial tears and proper eyelid hygiene can also be helpful. Promptly address any eye injuries or infections to prevent further corneal damage. Regular eye exams can also help to detect early signs of the disease. The prognosis for spheroidal degeneration varies depending on the severity of the condition and the individual's response to treatment. In mild cases, vision may remain relatively stable with conservative management. In more advanced cases, treatment can often improve vision and alleviate symptoms. However, recurrence of the deposits is possible even after treatment. Regarding recent research, researchers are actively investigating the underlying mechanisms of spheroidal degeneration to identify new therapeutic targets. Studies are exploring potential gene therapies and pharmacological approaches to prevent the formation or promote the breakdown of the protein deposits. Advances in corneal imaging techniques are also improving our ability to diagnose and monitor the progression of the condition. As our understanding of spheroidal degeneration continues to evolve, so too will our ability to effectively manage and treat this condition. Outro music fades in. Thank you for joining us on this exploration of spheroidal degeneration. Remember, early detection and proper management are key to preserving your vision. If you suspect you may have symptoms, please consult your eye doctor. Until next time, take care of your eyes.